Honorable Ameer Meea.
B461.
Mr. Speaker, sir, I'm informed that the United Nations Development Programme, in collaboration with my ministry, the Ministry of Environment, Solid Waste Management and Climate Change, and the Ministry of Industry and Food Security, would be partnering on the Global Environment Facility, Chemicals and Waste Project through a co-financing project proposal. In June 2019, the UNDP has allocated an amount of USD 4.5 million to Mauritius, subject to the submission and subsequent approval of a project concept. Out of the USD 4.5 million, my ministry is expected to benefit an amount of USD 1.1 million in relation to the setting up of a central healthcare waste treatment facility. Mr. Speaker, sir, I chaired a meeting on 17th March 2020 with representatives of the UNDP, the Ministry of Finance, Economic Planning and Development, and the Ministry of Environment, Solid Waste Management and Climate Change to discuss on the management of healthcare waste and the proposal of the UNDP to provide technical and financial assistance to my ministry for the implementation of the Central Healthcare Waste Treatment Facility. A project coordination committee convened by the UNDP was scheduled to meet on 20th March 2020 to follow up on the project. However, due to COVID-19 lockdown, the committee did not meet. In the meantime, on 27th May 2020, the UNDP submitted to my ministry a draft project document requesting for our agreement and a letter of co-financing. Subsequently, on 9th July 2020, at the first project coordinator meeting through video conferencing, the project document was discussed. Following the committee meeting, my ministry informed the UNDP of some changes to be effected in the project document, and a letter of co-financing to the tune of USD 925,000 was submitted on 22nd July 2020. Mr. Speaker, sir, the UNDP is expected to transmit the project proposal for validation by September 2020, and upon approval, the implementation is expected to start at the beginning of 2021.
Yes, Mr. Speaker, this issue has been long on the cards, and answering to a PQ in October 2018, the previous Minister of Health informed the Health High Court. I am informed that on 20th July of 2017, my ministry invited proposal for consulted services, the procurement of a national healthcare waste disposal facility for an open advertised bidding. The cost of the consultancy services was estimated around at 9.965 million rupees, 9,965,000,000. So, and later on, the bid was found to be not responsive. May I ask the Honourable Minister whether since then has there been any other bidding exercise for consultancy services?
No. Mr. Speaker, sir, no, there has been no further exercise of consultancy services because, as I have mentioned in my answer, that we are working on the UNDP program for the project of the UNDP.
The Honourable Minister seems to have much information. So can I ask him that presently which incinerator is operational, and also where the untreated biomedical waste that are generated by the public health institution are being disposed?
At present, the incinerator at Brand-Séquard Mental Health Care Center is being used to incinerate body parts from other hospitals and waste from the COVID-19 treatment center. Other waste are being sent to the Marshy Coast Filling Center.